Hello, 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 YouTube world. It's Miss Patti with For Your CNA, and welcome to our live weekly question and answer session where we answer all of your questions about CNA training and testing and workplace issues. And we'd like to welcome you to this week's lesson. So thanks for joining us. When you come in, if you can just give me a hi in the chat, let me know that you're here. Go ahead and drop all of your questions in the chat as well, and I'll get to those very, very shortly. For those of you who are new, who haven't joined us before, the way this works is that at the very beginning of our time together, I give a little mini lesson. So we talk about something that's relevant to CNA. And then after that, I'm going to answer your questions. So whatever questions you have, go ahead and put them in the chat. We'll get to them very shortly. So hello, everybody. So, hi, Wilma. Congratulations. Hi, Cals. I'll talk to you in just a minute. Hi, Charmaine. Hi, Jennifer. I know we missed you. We missed you. I was wondering what happened. Thanks for coming back. Hi, Hamill. Hi, Shane. Let's see. Oh, day shift. Okay, I got it. Hi, Tanya. Yeah, changing your schedule definitely mess you up for sure. So, hi, guys. Looks like we have quite a few on. So, let me jump into today's lesson. Now, I am going to apologize up front. I'm in Florida. We've got some weather moving in, and it's thundering and lightning. Now, yesterday we did lose power a couple of times during the afternoon storms. So, I'm going to keep my fingers crossed that everything goes really well today, but just bear with me. If the power goes out, I'm not going to be able to continue the live stream because I won't have power to do so. So I do apologize for that if, let me get this set up, if the power goes out. So sorry about that. Hopefully it won't. We'll keep our fingers crossed, okay? But today, the lesson that I want to talk to you guys about today, and I really kind of struggle with what I really wanted to bring up today. And I kept coming back to this over and over and over again. So I thought, okay, I'm just going to do a lesson on this. And it's something that it isn't really talked about a whole lot, but I think it's important and it bears some illumination. Okay, so today we're actually going to talk about Memorial Day, but Memorial Day specific to healthcare. And we don't really think about this part of Memorial Day. And of course, for those of you who don't know, Memorial Day is Monday. Most places are closed in honor of our lost and fallen military. And this is very near and dear to my heart as well. I think that it's a very important holiday, way more important than just having a day off of work or a day off of school. This actually is a very somber day. This is to honor those that gave their lives as the ultimate sacrifice to ensure our freedoms and our way of life. So I absolutely honor the men and women who have served in the military and lost their life all throughout our national history, but also their families as well, because the families make a huge sacrifice with the loss of their loved ones. So this is something that kind of chokes me up a little bit thinking about it. And while I do honor all military, all of those that, that need to be honored on this day, I want to specifically focus on the nursing part of this. And like I said, this is something that we really don't stop and think about too much when we think about the military. So a little brief lesson on healthcare in the military, specifically nursing in the military. So if you ever go to Washington, D.C., there's this memorial that you can see here on the screen. And this is specifically to honor those in nursing that have served in the military. So, wars can't happen without injuries, right? And when there's injuries, there has to be some sort of care for the soldiers that have been injured. And that's where the whole nursing aspect of this comes in. Now, to be fair, nurses are rarely on the front lines. Okay, that's usually the combat people that are on the front lines. Nurses are generally a step back in a field hospital, where they stabilize those that are injured, or they may be even a step further back in a permanent hospital that are caring for those that were injured in battle. So nurses aren't usually on the front lines. Now, there have been cases where that has happened, yes, but generally speaking, they're a little bit removed. And I think because of that, we don't really stop to think about the role of nursing in combat. But it's essential, because wars can't happen without injury. So when we have soldiers that are injured, there has to be somebody with that higher level of training and knowledge that knows what to do, that can stabilize the patient, that can treat the wounds, that can prevent infection, all of those things that nurses do. And nurses actually play a very vital role in making sure that our military remains healthy. And because nurses are in combat zones, maybe not on the front lines, but definitely in combat zones, of course, there have been situations where nurses have succumbed to war, right? So there are lots of military medical personnel that have given their lives so that you and I can remain free. And I want to take just a moment to really recognize that sacrifice. You know, as a nurse, it's way easier for me to remain stateside and work in a nice cushy hospital where I have air conditioning and I get my breaks, maybe. I know we're all short-staffed, but, you know, we get so busy in our own day-to-day life that we really don't think about what conditions these military personnel have to work under. And, you know, as a nurse, you know, would I rather work stateside in a nice hospital or doctor's office or rehab or wherever it is I'm working, or make a sacrifice to go away from my family, away from everything that's familiar, work in a hostile environment where I may, you know, be bombed or suffer a horrible event, right? When you put yourselves in harm's way. So the nurses that answer this call need to be honored, because they're giving up a lot to make sure that our military personnel have the care that they need as well. So I really want to honor the military nursing profession specifically, and especially those that gave their lives to help the military. So when we're talking about Memorial Day, I just want to kind of plant this seed. Now, when I was doing this lesson, I did look up nursing assistant, right? And I know that's our main focus here is CNA. But there's very little in what I can find that talks anything about CNA in the military. And there's actually not a designated job title for CNAs in the military. In fact, in most military hospitals, the CNA role is actually a contracted position, so a government contractor, where you are working for the government as a civilian with your CNA certification. And yes, there are job opportunities in military hospitals for CNAs. So if you haven't thought about that opportunity when you're looking for jobs and things like that, think about the military, because they need support as well. And it's not a job that most people really kind of think about. But I really kind of want to focus on, because it's Memorial Day, not Armed Services Day, I want to talk about those that kind of the history of nursing in the military. And like I said, this really doesn't specifically target CNAs, but remember, anywhere where there's a nurse, a CNA may be present to help that nurse. So let's learn a little bit of history of nursing in the military. So this was pretty interesting for me. Let me see here. Where am I? Okay, so this is pretty interesting for me when I was doing this research. And, you know, they can't really pinpoint exactly when nurses were present in the military, because like I said, anytime you have war, you have to have nurses to care for the fallen soldiers. I mean, that the two just go together. So they can't, there wasn't anything that I found that said, okay, the first nurse was in a, attached to a combat platoon on this date. It doesn't really work like that. I would suspect that nurses in the military have been around as long as nursing has been a profession. But the history here is that throughout our history, our United States history, there's always been nurses in the military. Always. So from the Revolutionary War to the Spanish-American War to the Confederate War to all of our overseas wars, World War I, World War II, Vietnam War, all of the wars that we have been involved in or have affected us, there have been nurses in some sort of combat support roles. So this is a very long-standing tradition. As long as we've had a military, we've had military nurses. But what was interesting to me, now I understand that, but what was interesting to me when I was doing this research is that it wasn't until 1901 that the Army Nurse Corps became officially a branch of the United States military. So you figure, 1776 is when we were formed, but it wasn't until 1901 where we, the nurses actually had an entire branch of the military recognized by Congress. So this is the Army Nurse Corps, and they are responsible for providing support and nursing operations to the combat area of whatever military operations are ongoing that we're involved in. So I found this was pretty interesting, right? 1901. So it's only been about 122 years or so that we've had a branch of the military specifically, but it's not limited to just the Army. Although the Army has the Army Nurse Corps, you will find nurses in every single branch of the military, but the Army was the first one to declare, hey, nurses are so important that we actually need an entire modality just for the nursing corps. And I thought that was really interesting. So, let me go back here. Oh, I don't have the next slide. It didn't get loaded. Okay, let me go back. All right, so what does this mean for us? Well, it means that we need to honor the legacy of these nurses. We need to understand that this actually existed. But we also need to take a moment while we're enjoying our Memorial Day to think about the sacrifices that those individuals have made. So one of the ones that I really want to pull out and focus on, and I didn't know this. Now, I've been a nurse a gazillion years. I actually didn't know this story. So this was kind of interesting for me. So in World War II, there were 67 Army nurses. I've got notes here so I don't forget. 67 Army nurses and 16 Navy nurses that were actually taken as a prisoner of war. So 67 Army and 16 Navy nurses were actually taken into a concentration camp run by the Japanese and kept there for 3 years as prisoners of war. So when we're talking about nurses in the military, we have to understand that they risked just as much as those on the front lines. And thousands of nurses have served over the history of our country. Thousands and thousands of nurses. In fact, in World War I, there were 10,000 nurses in World War I. So thousands and thousands of nurses have heeded the call from our government and served in the military, and some of them have lost their lives. So while you're enjoying your fireworks and your hot dogs and your day off, and we take a moment to remember those that have fallen, I want you to also think about the effect on the nursing profession that has had, and the nurses that heeded that call as well, and observe a moment of silence for them as well. And I think that's the right thing to do for us as caregivers, to honor the other caregivers that have made the ultimate sacrifice. So that's kind of my take. That's what I wanted to talk to you about today, because I think it's relevant with Monday being Memorial Day. I think that it's a good thing to kind of shine a light on. So I hope you guys kind of found that interesting, the history of nursing in the military. So let me see what you guys are asking here. So Wilma, congratulations. I'm super proud of you. Cals, I want to talk to you real quick. So I'm going to put a link here in the, let me put a link there for you. So Cal says, there are 4 of us from recently closed down Stone Academy in East Hartford. I'm thinking that's Connecticut. We have our test on the 30th, and we're all nervous. Please help. So unfortunately, Cals, I do want to help you, and I'm going to give you some resources to help you, but I can't teach an entire class in the 45 minutes that we have here together. So I'm going to give you some resources to help you out. I just put a playlist in the chat. So if you click on that playlist, it's going to bring up all of the replays from the last class. I just graduated them out yesterday. So this is a classroom. It was live when I was doing it, but then it got recorded. So this is a recording of all 8 of my classroom sessions. If you start at 1 and go all the way through and watch all of that content, it will get you ready for the state exam. So it's just like you sitting in my classroom, except you're attending from somewhere else. Okay, so it's all the same instruction that I give my current students. Now we also, on our website, I'm going to give you this as well. So on our website, do that. Okay, yes. So on our website, we have a free ebook that will help you with the written test. While you're on that website and you sign up for the free ebook, it'll be delivered to you via email. But when you sign up for that, you'll also see our skills videos, our animated videos, a workplace personality quiz. There's all kinds of stuff on our website to help you prepare for that state exam. So take advantage of everything that we have to offer to get you ready for the test. Now, something else you might want to consider, all of that is free, but to get a little bit higher level of understanding, if you enroll in our online program, our online course, that online course has all of that same information in it, but it adds stuff to it. So there's an additional lesson in there for each topic that's covered. There's additional topics that we don't cover in the classroom program. There's drag and drop activities. There's supply gathering activities. There's a lot of visual examples that we don't give on our free site. So the online, even though the free site is free and it's awesome, it'll get you a lot of the stuff that you need. The online program takes that as a foundation and just adds a ton of stuff on top of it, and it'll truly get you ready for the state exam. So you might find that helpful as well. But we wish you lots of luck. Let's see here. Thank you, Jennifer. I appreciate that. Helen, hello. Good afternoon. Real Life says, hi, I'm new, looking to sign for CNA certification. Time to have a career, not just a job. Well, you're in the right place, Real Life, and welcome. Blue, hey. Helen says, I'm okay now after a serious headache. Oh, I'm so sorry, Helen. I'm sorry to hear that. I get headaches too. I know, they're a super bummer. They're horrible. Let's see here. New Homestead, first time catching you live. So happy to be here. Well, we're so happy that you joined us. Natasha says, good afternoon. My name is Judine. Hello, Judine. Gladys says, hello, new here. I'm very interested on beginning a CNA program. Anyone from New York can recommend a good program. We'll greatly appreciate it. Thanks. Oh, Gladys, well, welcome from New York. We have a lot of programs that work with us. Off the top of my head, though, I can't give you any names of any specific ones. Some of the New York BOCES contract with us. But independent, right now my mind is kind of a blank. But in New York, any state-approved program will meet your needs. But our everything that I just talked to you guys about a few minutes ago, all of that is relevant for you as well, because New York also uses prometric testing, which is what our resources are based on. So everything that we have, including the ebook, the videos, the animated lessons, our online program, all of that is relevant to you too, and it will help you on the state exam. Once you find the program that you're going to enroll in, we would be additional study to that. Let's see here. Hamill says it's also a good opportunity to work to federal employees if you get a chance. Oh, you are absolutely right, Hamill, and I wanted to talk about that too. Yeah, if you go to work in a military establishment as a government contractor, as a CNA, it is you get federal benefits, and a lot of times it's easy to kind of move around the country. And a lot of the CNAs that you see in on military bases are spouses of current military members, because it's a way to be able to kind of move around with your spouse very easily. Now, something else that a lot of people don't think about when they're looking for employment as CNAs is the Veterans Administration. The Veterans Administration has awesome benefits. And again, you have the ability to kind of move around within the VA system a lot easier than moving about in the civilian population from state to state. The VA system also provides a lot of educational reimbursement, so if you want to move up in the ranks, you can. So there's a lot of benefits to working either as a government contractor through the military system or through the VA system. And both of these are very under publicized, right? It's not something that you're going to see on a jobs listing, or it's not something that most people think about when they think about going to work in medicine. But those two areas do need additional healthcare help, right? Everybody's short-staffed, everybody. So think about those opportunities when you're looking for a job as well, because the benefits are awesome. And you get to meet a lot of really cool people that have some really cool stories. So Judine says, I'm glad to be here. Thank you. Helen says, how much does the online course cost and for how long? Great question, Helen. So our online course is self-paced. So you go through it at your own pace. You have a year access to it. So when you sign up, you can view any of the lessons for a year. You can go back and repeat lessons as often as you want to. It's up to you how fast you want to go through it. But it takes most people about 3 to 4 weeks to go through it. Some people do it in a lot less if they don't have much going on in their life and they can devote the time to it. But usually about 3 to 4 weeks is the average it takes most people to go through the program. But it'll completely get you ready for the state exam. Natasha says, I have so much passion for people. It's amazing to be in this field. Oh, thank you. I really like that. And that's super important to remember, that when days get hard and long and, you know, you tend to kind of, I don't know if I want to do this anymore. It's really important to remember what brought you into this field to begin with, because you can get burnout in any field. Anything that you do for long enough can become like a chore. So it's sometimes important for us to maybe leave ourselves some breadcrumbs to find our way back to what brought us into this field to begin with. And that's kind of what I hope that I can help you do with these weekly lessons, is reignite that spark and that love of helping people, and remind you why you decided to get into the nursing profession to begin with. So I'm super happy that you guys are joining us on our journey. So does anybody else have any other questions for me this week? Does anybody have any questions? What are your Memorial Day plans? Cynthia says, what you do is so important. Thank you. Oh, thank you, Cynthia. I really appreciate that. That makes my heart so happy. I love spending this time with you guys. I truly do. This is the highlight of my week, and I try my best. My schedule is just so crazy. It's all over the place. I'm juggling a lot of things. But this is a big priority in my life, to make sure that I am here on Thursdays at 3, ready to go, to spread some joy into your lives. And I'm so happy that you guys take time out of your busy day to come watch and participate and light my life up a little too. So this is definitely a priority day for me. Okay. EDP, I'm so sorry, but I am going to be blocking you because those are not relevant questions to this format. So Natasha says, I learned so much from persons I have worked with. I agree, absolutely. I have learned a lot from my patients as well. And remember that everybody has a story, right? And that kind of goes into what we're talking about today. Everyone has a story. You have a story. I have a story. What brought us to where we are in life, right? You are a sum of all of the experiences that you've had. But how depressing would it be to get all the way to the end of your life and you have all these stories and all these fantastic experiences and nobody wants to hear them? If you have no one to share them with, they're going to feel very hollow. Those experiences are going to feel kind of meaningless. So part of having experiences is having somebody somewhere to tell about those experiences, right? To share them. So that's a lot of what we do as healthcare providers, is while we're doing the bathing and the dressing and the grooming and the feeding and all the tasks that we learn to do, a big part of why we're doing those tasks is to give the patient an opportunity to share their life stories with us. And that helps them emotionally as well as physically. So it's really, really important that we don't forget, while we're so busy focusing on the physical aspects of CNA work, we don't forget about the emotional aspects as well. And if we're working with military individuals, there's some stories there that they may need to share and need to get out and need to kind of process. So being available to listen to them is important as well. You know, some of the most precious memories I have, I'm going to be very personal here for a second. My grandfather was in World War II, and he suffered some very traumatic injuries that lasted his entire life from World War II. And toward the end of his life, I spent a lot of time at his house, and I would sit on his back porch with him, and he would tell me stories that he had not told anybody else. Nobody, not his wife, not his daughters, not anybody. But he was nearing the end of his life, and he really had a desire to pass this knowledge on. And it was a time that I was able to bond with him just by having the time to sit and listen. And I learned things about my grandfather that I did not know, that I had no idea about. And it was a very, very precious and personal time in my life. And I'm so, so grateful that I had that opportunity to connect with him. But what if I wasn't there? What if he had nobody to share that information with, those stories? I think that he probably would have struggled a whole lot more. So I'm very, very happy that I was able to be there to give him that peace that he needed. So when you are working with somebody who is talking and relating stories and telling you about their life experiences, try to remember that that's an important part of what we do, and try not to rush them through it or to act disinterested, because if they're talking, they have a need to talk. So that means we have a need to listen. I hope that helps. Oh, thank you, Natasha. I appreciate that. Hi, Monique. Okay, so Hamill says, I wish you could also teach medication aid. Currently, I'm in medication assistance class. Yeah, that's interesting. That's very interesting. And we used to, years ago, I used to teach the class. But here's the thing about medication aid. every state has different laws and rules and parameters. So it's not, you have to go to a medication class in your state, but also there's different levels of medication aid. So if you're working in assisted living, that's one type of class. And here in Florida, that's a 6-hour program. But they're just now approving something called a qualified medication aid for nursing homes, and that's a 40-hour class. They haven't done the rulemaking on that yet, so I don't know what that's going to entail, but it's going to be a 40-hour class. Now, other states have training that is way in excess of that, over 100 hours for a nursing home. Other places for assisted living only require 12 hours. So every place is different. It's all over the place. So you have to, that's one of the reasons that we don't teach it, because there's so many different variations. And then you've got self-assistance with medications in a home setting, which is a totally different thing and requires a different type of certification. So it's very disjointed. There's not one standard that meets everything. And almost all of them have to be done in a classroom setting. So me teaching it online isn't going to help anybody because it's not going to check the boxes. It has to be done in a classroom setting. And I'm okay with that. All right, so let's see here. Let's see. Natasha says sometimes you get so attracted to these people, they feel like family. Yeah, you do. You get attached for sure. For sure. Helen says, thank you for giving me a little bit of American history. You're welcome. Okay, I'm going to call you restaurant. Oh, Jasmine. Hi, Jasmine. I'm new here, just coming to America, and I'm very interested in becoming a CNA, but my English is so bad. My first class is this Saturday. Hope everything goes well. Oh, we're going to send good vibes out to you. Don't give up. One of the ladies in the class that just graduated, she came to my class and she didn't speak much English either. And it was a little more difficult for her, of course, because she had the language barrier and she had to study a little harder. But the biggest thing to understand, and this is probably was the hardest part for her, is that as a CNA, you can't just do the steps, right? I can show you what to do. You can watch my videos and you can kind of parrot what I do, but you still have to be able, just like we were talking a few minutes ago, to talk to the patient and to, at the very least, explain what you're doing. So even though you are struggling with English, it's okay. It's okay, but you do need to understand that a big part of what we do is communication with the patient. So hopefully you'll be able to pick up a little bit of English along the way, and you'll feel a little more comfortable and a little more secure. Now, I tried to learn Spanish. I went through an app on my phone, and I did 800 days in a row in Spanish. And that's a lot of days, guys. 800 days in a row. And I am not fluent at all. I could probably say a few things. I could have a basic conversation, but I'm definitely not fluent. So I understand the challenge here. I really do. I get it. And I don't want to be discouraging. I want to encourage you. But I also understand just how hard this is. It is difficult. It is absolutely difficult to learn a new language. The best opportunities you have to improve is to talk to people. Just talk and listen, and talk some more. And that way you're getting real world practice, which will actually improve your speech better than anything else in the world. So we welcome you into the country. We welcome you into healthcare. We're providing encouragement. Don't give up. But you probably will have to work just a little bit harder than the other people in the class. But trust me, it's worth it. Let's see here. All right, guys. So, social media, I want to give you guys a, invitation to join us on social media. Those of you that are getting ready to test, you may not know this, but we post a question of the day every day. So the question shows up, The answer choices show up. We're going to tell you what the right answer is, and then we explain why that right answer is right. So we've been doing this for a very long time now, so there's lots and lots of practice questions on our social media. Go check them out. They're on all of our channels. Go check it out. And we also post links to our lives and our classroom sessions and all kinds of stuff. So if you haven't already, follow us on social media. And if I could ask you to, on YouTube, down here at the bottom, probably over here somewhere, YouTube has like a thumbs up. Yeah, can you hit that thumbs up for me? And that just tells YouTube that you like what you saw here, so they'll recommend it to other people. And that way other people can learn about us as well. So if you haven't given us a thumbs up, please consider doing so. Let's see here. All right. So I went through your questions. Anybody have any last minute questions before we get to our congratulations time? Any last minute questions? Of course, I'll be back next week, next Thursday at 3. I've got 2 weeks off of class, so no classes until June 12th, okay? And starting June 12th, I'll live stream my classes again, so if you weren't able to catch the last one, you can watch the replays, or you can join me live in class starting June 12th, and I do answer your questions in class as well if you join us live on YouTube. So make sure you join us for that, and then the first and third Tuesday of every month, we do our game show where we give away prizes. It's live, but it's a great way to practice test questions for the written exam. So we hope you join us for that. Those are the first and third Tuesdays of each month at 11 a.m. 11. So I hope you guys can join us for that. All right, let's get to our congratulations. So this is my favorite part. I get to congratulate those that stop by our YouTube channel and let us know that they passed the state exam. So if you're testing soon, please stop by, put a comment on any one of my videos, but a new comment, a fresh comment, not a reply to somebody else. Give me a fresh comment, say that you passed the state exam, and we'd be happy to give you a shout out on our upcoming weekly show. So this week we want to congratulate Moises Placentia, Dotsali McFarlane, Yella Bowley, and Wilma McDowell. So congratulations to all of you. Great job and welcome to healthcare. We've got a couple people testing soon. So Coffin Angel and Buchra Carmaine. Best of luck to you. We're going to send out great vibes your way. We know you're going to do fantastic. And if you haven't yet, head over to our channel or our YouTube. I'm sorry. Head over to our website, foryourcna.com. And in fact, I'll put that in here. So here you go. Go over to our website and download the ebook and watch the skills videos, and that will get you ready to test. So we're going to do our best to support you. And then come back and let us know how you do, okay? All right, guys, so that's going to wrap up today. Remember, Monday is a holiday. It's Memorial Day. Take a moment to remember those who have fallen and honor their families as well for the sacrifices that they've made. And hug somebody that worked in armed forces and tell them that you appreciate them and their sacrifice as well. So until next week, guys, thank you so much for joining me. I'm so happy that I got to see you this week. Until next week, happy caregiving. Bye.